All patients are given extensive teaching when they start therapy, and we give them guidelines, both verbal and printed, in terms of what are the things that they need to report to us. So if a patient is having more than 4 episodes of diarrhea in a day's period of time, we don't want them just to take a remedy that's been recommended, something over-the-counter prescription, but we want to have them call us to discuss what's going on. We typically see the early onset toxicity from 5-FU or capecitabine in a first or second cycle of therapy. There have certainly been case reports where it can happen later in a patient's treatment, and in our practice we have had personal experience with it happening later in a patient's treatment, but in general you're going to see this in most patients in the first or second treatment cycle. If you have a patient that's experiencing something that's outside of the norm, the patient who is calling your office and telling you that they can't get out of bed, they're unable to eat or drink, they have been experiencing nausea and vomiting that's not responding to the medications that you've given them, and this is really atypical for that classification of drug. Capecitabine and 5-fluorouracil certainly have those potentials, but we generally don't see side effects that severe in the majority of patients. So if a patient is telling you, I'm so sick that I can't eat or drink, I'm so sick that I can't get out of bed, my family is telling me, or if you have a family that's calling in and reporting that the patient's confused, that they are developing mouth sores within a couple of days of when they have started treatment or completed treatment, those are all really cardinal signals that there's something going wrong with this patient. You will always have the issue of having people needing to report those symptoms accurately. So patients will get into a frame of mind where they feel that they don't want to call the office, they don't want to be perceived as complaining. They may say, oh, I'm just going to wait until my next doctor's visit, or I'll wait until I'm going to be close to the medical center to have a conversation. But we really impress upon people repeatedly that we need to hear from them as soon as possible. If it's an evening, weekend, there's always people available. It's critically important that they report things that are not going well. And we tell people that we always like to have a conversation with them prior to the point in which they're going to need to go to the emergency room. I think what we're realizing with both 5-FU and capecitabine toxicity is that this actually can be an emergency, and emergency rooms in general are very accustomed to taking care of chemotherapy patients who come in with a fever. Could represent infection or sepsis. But the whole notion that somebody could be emergency room bound as a result of toxicities from 5-FU or capecitabine, I think for a lot of people is somewhat of a new concept. If you look back in the state of your practice, you may have said, oh, I can remember a particular person that was extraordinarily sick, but you sort of pass it off and say, oh, there's always going to be that one person who's not going to do well with something that we otherwise expect that people would be okay with. In our practice, because we've had experience now with patients with these types of toxicities, and we are recognizing what they are, we've educated not only our nurses, but our physician staff, our infusion staff, our home infusion staff who are seeing the patients when they're having a disconnect of their 5-FU infusion pumps. We are now starting to put into place education with our emergency room staff, because we're seeing this and we're recognizing that this is not something that doesn't happen. It does. But in our practice, the protocols that we put into place is basically to raise the index of suspicion. And so if we go down the list of what are really the alerts, what are the red flags that we see in patients, we are not just saying, oh, we'll call you back tomorrow, or why don't you let me know how you're doing on Monday. We are looking at instituting antidotes sooner than later, because we know that it's critically important. I mean, people can become hospitalized, people can become critically ill, people can die if they're not appropriately managed.